In the past, we kind of have not really been focused on, kind of been that invisibilized group.
It does still feel that I'm not visible just due to a lack of knowledge. It's not that transgender people haven't been around for very long, it's just that only recently is the medical community starting to think about us.
As a gay woman, I don't feel that the health industry has enough information.
And so being visible and feeling safe and being listened to should be given and top priority.
I'm really excited for this program to say, hey, no, we're all experiencing these issues. We all need support around these issues.
As a trans person, my experience with the medical community has been frustrating at times, especially like when I attempt to see a doctor for a trans-related medical concern. A lot of times I'm just met with like, we just don't have enough research to understand quite why this is occurring with you.
The lack of data has been a major problem for a number of years. It's really only been in the last 10 years or so that the big health systems, the surveys that go out to people nationwide, have included any questions about sexual orientation, and only a handful of them have any questions about gender identity.
It's just frustrating to be met with like the utter lack of research on people like me because it directly affects my life. If I can contribute to anything that helps change that paradigm, I would like to.
Back in the 1980s when, the AIDS epidemic hit, LGBT people had to like rally for themselves, by themselves. So now that we actually have, the NIH to come in to help us kind of look more closely at our community, it's something that we should definitely take advantage of.
The more that the medical provider and medical community can learn about our experiences, our lives, our families, our struggles, our joys, the better that they can meet our needs.
To have an intentional focus to include a broader community feels good.
All of us is really taking this approach to make it inclusive of as many people as we can.
I think this program is going to be so phenomenally huge because it really is going to hopefully encompass all of us.
And learning about all of us, it totally clicked for me.
We'll have the information from 1 million people, people of color, LGBT people, people from diverse communities to tell us about themselves.
To get their biological information into the database so that there's more information to work with when trying to develop new ways of treating people.
I want to be a part of a program like the All of Us program that collects this hard data to make decisions in the future and help others.
This is a game changer to have a program like this that really is going to look at the nuances of what we experience.
By enrolling in the All of Us research program, it's you're one in a million, and your unique story is like a part of this larger narrative that you might see yourself as just being a small person, but when you have that data amongst so many other stories and other people's health data, I think pictures can emerge and that you can actually contribute, have an impact on the future of the health of our community.
I'm really excited to be a part of this initiative and to start bringing awareness to the various issues in our community.
It's really a much broader call to stand up and be counted. All of us being seen will give us hope.
My hope would be that the All of Us research program would just get people to really be aware and understand that by them being proactive and joining, that it helps other people.
Whatever information that you glean from me helps someone like me or anyone else in the future.
Enroll, get involved,